Okay, so this session, the intention here is to introduce you to the GAPS concept, what it is, what it looks like, where it comes from, and the science behind it. So you really understand the biochemistry, the science, what's going on to create these symptoms. The GAPS is an abbreviation for gut and psychology syndrome and gut and physiology syndrome. It was the concept was created by Dr. Natasha Campbell McBride in 2004. She has a great book out called The Gut and Psychology Syndrome. She's working on another one called The Gut and Physiology Syndrome. She pulled this diet together, but the principles behind the diet are not hers. They are it's based on traditional food, traditional healing, using food in a way to promote healing in the body. And over the last few years, she has certified a number of GAPS practitioners around the world in how to use this nutritional protocol, how to explain it to people, how to coach people through it. So I went through her training. She still coaches us quite regularly and how to tweak the diet for particular situations. She still practices in Cambridge in the UK. She's a medical doctor. She has 2 postgraduate degrees, one in neurology, one in nutrition. And so what I'm going to present here is based on her work. So it's been said that Hippocrates noticed way, way back that there was a link between what's going on in the gut and the diseases that develop around the body. So this is not a new concept, but in recent years, just in the last decade really, our understanding of how and why this is, what the connection is between the gut ecosystem and the rest of the body has really, really exploded. We now understand it so much deeper. We're still learning more and more, it seems, all the time. But basically, the GAP syndrome establishes this connection between the state of the gut and the health of the rest of the body. And the nutritional protocol offers a way of using food to improve gut performance. And when you do that, you relieve symptoms of illness. So, and it's also a lot more than just a diet. It's really an educational program. You need to understand what's going on in your body. You need to understand how to read your body and your symptoms so you know whether the diet is working or whether or not you need to tweak it a little bit. And my intention here is to give you, the rundown of the whole process and how to troubleshoot for yourself, because no one diet fits every body, right? Every body is different, and you'll probably need to do some tweaking if you're going to apply it. So really, I'm trying to offer the education about why, what's going on, and also a rundown of how to implement the protocol. So, what kind of health problems are we talking about that fit into this GAP syndrome? So, that is to say, what collection of symptoms do we know have gut imbalance as a contributor? So, let's start with children. Here are some of them: autism, the whole autism spectrum, attention deficit disorder with or without hyperactivity, dyslexia, dyspraxia, a large group of learning, behavior, social problems that don't fit into a diagnostic box. It's estimated that about 80% of children who are referred to psychiatrists fit into this group. They kind of, they defy diagnosis, but the parents and teachers and everybody around them knows that something is off. And then epilepsy is still a bit of a mystery, but Dr. Campbell McBride really strongly believes that childhood epilepsy, in the vast majority of cases, is a GAPS condition, and it can be helped with this nutritional protocol. The majority of childhood epileptic cases are idiopathic, which means we just don't know what causes them. And her clinical experience and her research, and she's not alone on this, there's lots of other doctors who have seen this as well, have shown that seizures can be the result of toxic accumulation in the brain, and that toxins initiate abnormal electrical activity in the brain that show itself as epileptic seizures or involuntary movements, Tourette syndromes, this sort of thing. So she's seen a lot of people with seizure disorders be helped by balancing out what's going on in the gut and relieving the toxic overload in the body. We'll talk a little bit about why and how. One of the things before I move on, I want to say that, this list here, these are neurological conditions that we see in kids for which gut imbalance can be a major contributor. But I want to say that they represent a rather progressed state of gut imbalance to the point where the brain has been affected. But there are lots of early signs of gut imbalance in kids that typically precede these issues. And I talk a lot about these more extensively in my course on introducing food to babies. I think that every parent needs to be aware of these very early signs of impaired digestion. Things like skin rashes, recurrent infections, food intolerances, constipation, diarrhea, those sorts of things, so that you can rebalance the gut early. You can identify triggers that are causing irritation and allow healing to happen before damage has really set in. So I just want to mention that there are some earlier signs that tell us that a child might be at risk for developing GAP symptoms later in their life. In adults, lots of neurological, psychological issues can be the result of the GAP syndrome. This idea, so substance abuse, eating disorders, depression, obsessive compulsive disorder, manic behavior, schizophrenia, again, the epilepsy, the tics, and the fits. This idea that there's a real physiological underpinning, a real biological underpinning to neurological conditions is not new, and it's not specific to GAPS. Orthomolecular doctors of functional medicine, holistic psychiatrists, they've known this for a long time, that the treatment of psychiatric diseases requires a rebalancing of the body's biochemistry. And the GAPS nutritional protocol can be a really powerful tool in that rebalancing because it helps to eliminate toxins, it helps to rebalance the gut flora, and as we'll talk about, the gut flora are real regulators of so many things in the body. There are lots of non-neurological symptoms that are also related to the GAP syndrome. This is why the definition has expanded from the gut and psychology syndrome to the gut and physiology syndrome. It's becoming clear that people who experience neurological conditions, like what we just talked about, also typically have physical issues, other issues with other body systems. Or sometimes you have the physical symptoms around the body with no neurological symptoms. But so digestive problems. In fact, I believe it was a gastroenterologist that made the connection first between what was going on in the gut, the people who were coming to see them for gut issues, and they were noticing that a large percentage of them also had neurological things going on. So they made that connection a long time ago. So all digestive symptoms are a clear indication that there's some abnormal gut flora going on, which is damaging the gut wall, causing inflammation and irritation, and interfering with proper digestion and absorption. So that's a clear one. In some cases, there might be no pronounced digestive symptoms. There might be other physiological things like rashes, allergies, asthma, thrush, chronic bedwetting, chronic pain, cystitis, arthritis, autoimmune conditions. Sometimes digestion is perfectly fine, but there's still significant damage to the gut wall that's causing problems in other areas of the body. And we know from celiac research that it's very possible to have severe gut impairment, severe damage to the gut lining of the gut wall without having any gut symptoms at all. So we know it's very possible. Sometimes the brain isn't affected at all, like I mentioned, or it's only mildly affected. You might not even notice, in the form of like sleep problems or trouble focusing or brain fog, confusion, those sorts of things. Sometimes all you see are the symptoms in the other part of the body, most notably symptoms that relate to improperly functioning immune system. So things like allergies and asthma, autoimmune conditions. Sometimes the brain's not affected because the body has these amazing ways of protecting the brain. The brain is so important that it will be protected at all costs. So sometimes you don't see anything going on in the brain. You see it in the rest of the body. But there's still a connection between what's going on in the gut and the symptoms that you're experiencing. And we'll go on and talk about why that is and how that happens. Just to be a little bit more specific about the digestive symptoms we're talking about, when there are digestive symptoms, this is typically what we see. Babies that have GAPS are often affected by colic, and we sort of know this by reverse, because we know that children who go on to develop GAPS symptoms later in life, a large percentage of them had colic as a baby. And so we're taking that now to be a really early indicator of abnormal gut flora. And the theory here, nobody really understands what colic is, what causes it. But the theory here is that pathogens in the baby's gut convert food into gas, and then the bubbles of gas accumulate and cause pain and stretches things out. And so the baby cries until the gas dissipates. We find this a lot in, we're going to talk a little bit later about how impaired gut flora gets inherited through the birth process. And we see that there's really a strong connection there. And so that's the foundation of this theory. Bloating, flatulence, this is the same problem, gas overproduction, but in older children and adults. Stool abnormalities like diarrhea, constipation, these are cornerstone indicators of abnormal gut flora. Some will fluctuate between loose stools, constipation. Some will be a little bit more dominant on one side than the other. Feeding difficulties is a big one. I talk quite a bit about this on my website. I have a little download that you can take a look at. If you're dealing with picky eaters, this is a big indicator. It can be a big indicator of abnormal gut flora and an imbalance in the digestion. And it's important for parents to realize that in some cases, picky eating behavior, there's a solid physiological reason for being fussy with food and for being picky with food. And this has a lot to do with an imbalance in the gut flora, creating these byproducts, these toxic byproducts. And for example, what we see really often is kids that get addicted to milk and carbohydrates, these carboholics. And what we know is improper digestion of dairy and gluten can create these chemicals that are very similar in structure to opiates, and they fit into the opiate receptors of the brain, giving a pleasure signal, just like an opiate would. And so you start to see cravings, and you start to see addictions to these foods that actually make the child feel good, and they don't want to eat anything else. So there's a real physiological kind of underpinning here of what you're seeing as picky behavior, and a large part of trying to get out of that cycle is fixing that physiology, starting with the gut. So again, over to my website. There's a free download all about that. Food intolerances and allergies. When the gut flora is abnormal, the gut can't digest or absorb food properly. And so, and the gut lining gets damaged. We're going to talk much more in detail about this. It becomes porous and leaky, and it lets through undigested proteins in the form of peptides into the blood. And the immune system is patrolling the blood for proteins that it doesn't recognize. And so it sees these and attacks them. And this is the root of a food allergy or intolerance, is improper digestion. And the problem here is that, every symptom under the sun has now been associated with food intolerance. Everything from itchy skin to, sneezing, aching joints, muscles, headaches, even depression. There's between 200 and 300 symptoms that have been related to food sensitivity, and reactions can overlap. They can be immediate, they can be delayed. So it becomes really difficult to figure out what particular food the person, you're reacting to. So here, we're saying the key to dealing with food allergies and intolerance is to heal and seal the gut. So, it's helpful to be able to determine what the trigger is, what the irritation is, but simply avoiding that irritant for the rest of your life is not going to solve the problem, because the root of the issue is impaired digestion. So that's where you need to fix. That's what you need to fix and focus on. So the GAPS nutritional protocol has a really good record of removing food intolerances. And I talk a lot about that again in my Introducing Food to Babies course. Those of you who've taken that course will recognize a lot of the foods in the GAPS diet that I've taken and called them foundation foods for babies, particularly ones who are showing early signs of digestive impairment. Because it's so much easier at that stage to detect food triggers and irritations, remove them for a little while, and then increase these healing foods so that the gut can heal. Fecal compaction with overspill. This is a situation seen in x-rays by gastroenterologists. And what it means is that the bowel is basically not emptying and feces are caking the inside of the bowel. So it doesn't maybe look like constipation because food is actually able to pass through, squeezing through this sort of narrow channel. But in fact, it sort of is like constipation because the bowels are never emptying. And this old fecal mass provides a perfect environment for all sorts of parasites to thrive and toxins to be created. And so this is problematic. Needs to be cleared. And then inflammatory bowel conditions of all kinds are also associated here. So that was just a little rundown of the conditions, both psychological and physiological, that we know are related to poor digestive function. I kind of ran through them and didn't explain exactly what the connection is. That's where we're going to turn next. What is the connection between the gut and the rest of the body? And once you understand that, the GAPS nutritional protocol makes a whole lot of sense. So that's where we're going to turn next.